Hello, my name is Dr. Joe Childs. Thank you for visiting our site on migraine headaches. If you suffer from migraine headaches, you know how impactful they can be on your life, how frustrating they can be for somebody that is suffering with migraine headaches, whether it's you, whether it's a loved one, how they can affect your social life, your time with your friends, how they can affect your progress at work, missing days of work, your success at work. Migraine headaches, tension headaches, especially if they're chronic and weekly or daily for some people, it can really affect a person's life. When I was younger, my mother used to suffer from migraine headaches, and what I would notice is they would always come on at unopportune times, such as during the holidays when we were having friends or family over. What would happen is I would notice my mom wasn't feeling so good, and next thing you know, she's in her room in a dark bedroom for the whole night, sometimes the next day. And I used to hate that. It would be terrible because what happens is migraine headaches really take a big chunk of your life out. They affect you dramatically. So if you're suffering with these things, I want you to understand that I have an understanding from treating so many of these patients what these people are going through, people that suffer with migraine headaches. Now, what I'd like you to consider is, are you getting at the root cause of the problem, or are you just taking medications to mask the symptoms? Are you just taking this drug, that drug, trying this one and this one, trying different cocktails of drugs, different types of medications, trying to reduce your headaches? Are you feeling like it's not working so well? And typically when we hear this, we see lots and lots of patients with migraine headaches. Typically they're not going to a doctor who is looking for the true underlying cause of the problem. That's what we do differently in our office. We look for the underlying cause of the problem. Research has shown that migraine headaches and chronic tension headaches are caused by misfirings in the brain, particularly the brain stem itself. The brain stem is the seat or the area that controls all of your what's called autonomic function. Patients with migraine headaches function with or have autonomic dysfunction. So in your brain stem there are nuclei that control blood vessels to your brain. And when those blood vessels are not functioning well, they may swell, they may stretch, and they may affect free nerve endings. And most people take medications to alter the effect or constrict those blood vessels. The problem with that is the majority of these people have what's known as rebound headaches. So if you're taking some of the most commonly used medications for migraines, you end up with rebound headaches. So not only do you have the headache itself or the migraine itself, you get 2 or 3 headaches afterwards. So what we do differently is we do something called functional neurology, or what's called drugless neurology, to affect the areas of your brain. We can affect certain parts of the brain that cause headaches without drugs. We can use specific neurological stimulations to make those areas function better, to alter the physiology and improve the physiology or bring it closer to normal so that you have normal blood vessel function or more optimal blood vessel function. We also combine functional neurology with something called functional medicine or nutrition. So what happens when patients get migraines is, it's kind of like, and I like to explain it this way. Imagine you have this bucket. It's a trigger bucket, so to speak. And there is a threshold. Every person has a threshold. Even somebody that doesn't get headaches very often or at all, there is a point that bucket will become filled where they're going to get the headache, and we call that the threshold. People with migraines have a very low threshold because their nervous system is sensitized. So in the bucket, what's happening is the lower the threshold, the least amount of triggers you can take. So triggers can be things such as stress. They can be things such as changes in the atmospheric pressure. You hear people say, well, it's going to rain today. I get migraines when it's humid, or I get migraines when it's really hot, or I get migraines when it's very cold. It's different for everybody. But that's a trigger. Stress is a trigger. Those are two things you have a hard time really dealing with. I mean, obviously you can do things for stress. Then there's foods that can be triggers, food sensitivities, different types of migraine triggers, such as chocolate, such as beans, such as patients that have citrus fruits, things like that. And so what happens is once those triggers get to a certain point, boom, you have a headache. If your threshold is really low, it doesn't take very much triggers. You may be living this close to having a migraine every single day, and you put one more trigger, one more stress, one more thing like that, bam. So what we like to do is we like to nutritionally decrease the triggers with anti-inflammatory types of care, anti-inflammatory diets, anti-inflammatory supplements, and we like to address you neurologically and structurally, improving the parts of the brain that we just talked about to make your threshold so far away that you can handle all these triggers. So that's what we do. So getting back to the nervous system, when we look at the nervous system, we know that there's areas in your brainstem, one of them being the trigeminal nucleus. It stretches from the upper brainstem all the way down into your neck or cervical spine. When that area is unstable, it can really cause dysfunction in the blood vessels. And there's things that you can do, such as oxygen therapy. We use that in our office. We can do specific types of eye exercises, specific types of stimulations to make those areas in your brainstem that control the threshold of you having a migraine more stable. And at the same time, we can affect you nutritionally to reduce your triggers. And what we notice there is we notice that people have less and less headaches. Whether they're tension headaches, whether they're migraine headaches, our program is highly successful. This is just a short video. I don't have the time to sit down and explain everything in complete detail as far as what exactly we do to help patients with migraine headaches or tension headaches. You can see on this website there are testimonials of some of the hundreds of patients we've helped overcome headaches without drugs, without anything very invasive. We do drug-free care. It's nutritional and it's neurological, drug-free neurological based care. So if you want to learn more, or you would like to have a free consultation in our office, you can call us today. Our phone number is right here, or you can put your name and information in the box on this website, and what you can do is we'll send you more information on our free consultation. And when you come in for our consultations, our free migraine or tension headache consultation, we'll sit down, we'll explain exactly what it is we do, we'll sit down and listen to your certain set of migraine symptoms, because every patient with migraines is a little different than the other. We'll find out how it's affecting your life, we'll find out the frequency that you get them, we'll find out what the triggers are, and then we'll explain to you what it is we do, and we'll let you know exactly what may be a potential solution for you. All of that is free. We do a free consultation. It takes about 45 minutes to an hour. So if you would like to take advantage of our free consultation, just give us a call. The number is on this website. Thank you very much for listening, and we look forward to seeing you or any of your loved ones that are suffering with migraines or tension headaches very soon. Thank you very much.